Good morning, everyone. We're excited to present our GP² research project, Counting the Cost, a framework for measuring systemic racism in collaboration with the city of Vancouver. Next. I would also like to introduce you to my team who worked on this project for 4 months. I'm Kamali, Pahwa, Mia Song, Fariha, Kabir, and Elaine, Huang. Also, I'm going to quickly cover up what we're going to cover up today. We're going to start with the problem statement, then moving on to the approach we followed for solving this problem, setting up the background and context, sharing our findings, and finally, the recommendations we have for the city of Vancouver. Let's start with the problem statement now. The economic burden of racism is not hypothetical, it's a reality for many Canadians. But however, there's a lack of data in understanding the cost of racism to the society, and that's where we come in. This project aims to bridge this gap by researching the most effective methodology and framework for quantifying the cost of racial inequities. Now I'll be passing it on to Mia, who will take over the approach we had for solving this problem.
Thanks, Kamali. So under the one big puzzle of identifying methods that can quantify the cost of systemic racism, we approach this problem using 3 interlocking puzzle pieces. First, through our literature review, we aim to find out any existing costing methods, models, and/or frameworks that count the cost of racism. Second, we conduct interviews with academic scholars and government employees to identify any implementation gaps in existing anti-racism initiatives. And lastly, we'll conduct a drill scan to see what other governments have done, particularly across high-income countries, and what lessons can be adapted for the city of Vancouver. However, as we work through this process, we did encounter several key limitations. First, there's very limited information on models that can assign an exact dollar value to the cost of systemic racism. And some models we found can only assign an indirect costing to the cost of racism. And second, there's a lack of Canadian research. And much of the existing work comes from the United States, which has a very different demographic structure compared to Canada. And third, we found a lack of municipal level case studies. Well, we found case studies on the national level. However, that means it's harder for the city of Vancouver to draw direct parallels. And lastly, some models we found are health sector focused only. While still being useful, they cannot fully capture the broader economic and societal cost of racism, which is the core of this research. Now I'll pass to Fariha to introduce our key findings.
So we faced numerous challenges in our approach while we were trying to problem solve our way through this question, but we persevered. And we came up with 4 models that we think can work in putting a cost or a dollar amount on what racism costs to society. Our first model is the Noah's et al. Framework. Our second model is the Oxford Economic Forecasting Model. Our third model is the Burden of Disease Model. And our final model is a Logit and Probit Regression Model. Now, what each of my colleagues in turn will do is that we'll explain the key features of every model, tell you how we think the city can apply it, and walk you through the strengths and the challenges of implementing that model. So if you move on to the next slide, you get to see our first model. Now, what is this model? It's basically a conceptual framework for you to understand what systemic racism is and understand the different areas that systemic racism basically has an impact. If we move on to the next slide, you get to see this model in vision. So the reason that we call it a cycle model is because it's a cyclic representation of racism. What it does is it underpins different areas like you have housing, voting and representation, economic opportunity, employment, education, healthcare. So this model basically presents a very comprehensive way for you to define racism. And number 2, also identify the different cost areas you have to take into account in your analysis. If you go back to the slide before, we can come back to the model where you get to see that the city of Vancouver can basically apply this model as a starting point in their analysis to understand how to scope out the costing analysis. The strength of this model is that it's transferable across sectors. It's multidimensional because of all the different components, and that it's grounded in well-established research. The downside or the weaknesses of this model is that it doesn't produce a direct dollar amount for the cost of racism. So it'll give you a framework, but it won't give you a cost. The model has been developed in the US context, so there are transferability issues. And lastly, it requires extensive collaboration for data collection. I'll pass it to Kamali, who'll walk you through a second model now.
Okay. So think of this model like, we call this the umbrella model, but think of this model like a weather forecast. I have a quick question here. What does the weather forecast help you with? Exactly. And that's what this model does. So it predicts economic trends over chosen economic indicators over time. Now, these economic trends and indicators could be employment rate, wages, etc. But how did we apply it to the city? We compared the racialized and non-racialized groups over chosen economic indicators over time. Now, this gives us a difference. That difference is one of the economic costs of racism to the city, affecting the city's overall economic health. Why did we use the model? Because it has certain strengths. First, it tracks changes over time, and that's why we call it a forecasting model. Second, it's very flexible. It's adaptable to the city of Vancouver. Third, it helps us compare different communities, like here, racialized and non-racialized communities. But yes, it does lack. It has certain weaknesses. It does not produce a dollar cost. It does not give us a monetary cost of racism. It just focuses on chosen economic indicators like wages, employment rate, and doesn't give a holistic or full economic impact analysis. And third, it requires historical and current data collection. So it's very time sensitive and time intensive with a lot of technical expertise and economic analysis needed. Now I'll be passing it on to Mia, who will take you over model number 3.
Okay, so now I'll walk us through the burden of disease model, which is a widely adopted approach to measure the cost of racism on public health and was lastly used in 2024. So the burden of disease model focuses on measuring the experiences of racial discrimination and their impacts on health outcomes. It uses a metric called disability adjusted life years, or DALYs. And DALYs has two primary components. The first one is the years of life lost due to premature death. The second one is the years lived with disability from chronic illnesses or mental health conditions like PTSD or depression due to racism. And when studies are calculated using these two components, they cannot be converted into monetary terms. This is done by assigning a value to each DALY, either based on the healthcare service spent or the lost productivity due to illness or early death. This is also the stage where economic expertise will be required. The model presents several advantages as an internationally recognized, well-established health economic framework. For example, Australia used this method to find out that racism will cost them more than $44 billion per year in public health solely. And it also provides a clear and evidence justification for anti-racism investments. However, despite these strengths, the model also presents several weaknesses. First, it cannot produce a direct costing without expertise in health economics, and also requires extensive collaboration and access to high-quality race-based health data, which is not currently available on provincial or municipal level here in Canada. And the results will only be health sector focused. Now I'll pass to Fariha to introduce the fourth model.
Go over.
Yeah.
Now I'll explain the last model, what we will call the door model. Imagine you're trying to figure out whether people are getting through a door to access city services. Some people get through and some people don't. Our question is, does the color of someone's skin, their income, gender, or neighborhood affect whether the door opens for them? The logit and probit models are just statistical tools that help us answer this type of yes or no question. We input the data into the model about each person, their race, gender, and other characteristics, along with whether or not they got through the door. The model then analyzes this yes or no access data to determine how much more or less likely people from racialized groups are to be denied access compared to others. And why should we use this? Because without this type of regression modeling, you might see that racialized people are getting worse service, but you won't know if it's because of race or because of other factors like income or where they live. This model tries its best to isolate the effect of race, the real effect of racism, and how it affects people's daily life. You can apply this to any context and to any city service depending on what data you want to see. But the model doesn't give you a dollar cost directly. It gives you a percentage gap, like Indigenous residents are 15% less likely to access a certain city service. And then we take those disparity estimates working with economic analysts who will then translate these disparities into financial terms, like the cost of lost productivity. So this is one of the disadvantages because it requires an additional analytic step to then calculate the dollar cost of racism. Now I will pass it back on to Fariha.
So our research question was around identifying the best models and the best frameworks for putting a dollar amount on the cost of racism. And what we've now presented to you are 4 models that we think are able to operationalize that for the city. So just to bring you back into the room and introduce you or review all the 4 models that were introduced to you, the first model that I discussed was the cycle model. And we had mentioned that the cycle model can basically be applied by the city of Vancouver as a framework in their analysis and the starting point to define what systemic racism actually is. Then we had the second model, if you remember the weather forecasting model that was introduced by Kamali, as we call it the umbrella model. And what that allows you to do is it allows you to forecast differences between racialized and non-racialized communities. The third model that was introduced by Mia, the burden of disease or health model, can basically be applied to estimate the cost of racism, but that's only applicable in a public health context because it's a health-focused model. The final model that Elaine introduced, which is the logit and probit regression or the DOOR model, can be applied across city services to identify the cost of racism. If we move on to the next slide, now that we understood all 4 of our models, our next step was figuring out, okay, which one should the city apply? Which is the one that is most applicable to them? And in order to come to that answer, we did a criteria analysis. These criteria we developed collaboratively with the city to make sure that our solutions and our models are very catered to their purpose and to their governance structure and to their services. The first criteria that we thought about is, does the model give you a cost estimate or not? Because that's what we're trying to capture. So do you get a clear quantifiable cost out of this model? The second criteria we looked at is how applicable is this to the city of Vancouver? So does it apply to their services? Does it align with their governance structure? Does it align with their priorities right now? So how suited is it to them? The third thing that we evaluated is how easy is this to explain to the public and to elected officials? We have been working with a context where one of our assumptions for the project is that, financial allocations towards anti-racism initiatives are declining. So when we're working with that context, something that was really important communicated to us by the client is that, this needs to be a clear model that is intuitive to understand, it's easily digestible so that there is uptake and there's replication and there's support for it. The final criteria that we thought about is the time and human resources. The city of Vancouver is already stretched thin because they're coordinating across so many multiple crises at the same time. So whatever costing analysis we present, it has to be such that it does not require extensive resources or that it won't require too much time. So if we now go through each of the models in turn, for the cycle model, because it's a framework, it doesn't give you a cost. It is applicable to the city because of how many different dimensions it focuses on. If you remember in the cycle, it captured multiple different components. It is definitely easy to explain because it's just a conceptual framework that you can relay. But it does require significant time and resources, once again, because of how many different components there are and the fact that you would have to do data collection across all of them. If you come down to the second model, the umbrella model, once again, it doesn't give you a clear quantifiable cost, but it is applicable to the city because of its focus on economic indicators. At the same time, the reason that we ticked no for the last 2 criteria for the umbrella model is because it requires technical expertise, statistical modeling, and heavy economic understanding to actually be able to compute the forecasting that is needed, plus the fact that it requires historical and current data collection. The third model that was introduced by Mia, it does estimate a cost. Even though it's just in a health context, it will still give you a quantifiable cost by converting the DALYs into monetary terms. But because the city is not directly involved in the provision of health services, it's not directly interlinked to what the city of Vancouver city services are. But it is easy to explain because it's a model that has been around for multiple years now, and it is established in a well-established tool, even in public health contexts. But once again, because it needs race disaggregated data at the health level, and this data is not available right now, a lot of time and resources would have to go in for the data compilation. The final model, it gives us a cost. It is applicable to the city, but once again, because of the expertise that are needed, it requires more time. So on our basis, our evaluation said that Model 1 and Model 4 are the best models for the city to proceed with in order to do a costing analysis. Now, Elaine will walk you through the next steps that are needed for the city in order to implement this costing analysis.
Our implementation strategy centers on 5 key actions: building internal buy-in through strategic alignment, creating a cross-departmental team, conducting budget analysis, mapping available data, and developing expert partnerships. This approach ensures we have the organizational support, expertise, and necessary resources needed. By addressing both internal readiness and external collaboration, we've created a framework that balances thorough preparation with practical execution. This concludes our presentation. We would like to thank Professor Andrea, Professor Tara, and Krista for their unwavering support. And we would also like to thank Professor Emerald from the Vancouver School of Economics for helping us formulate the Probit and Logit model. And finally, thank you to our client for giving us the opportunity to do this project.
Great job. Okay, we're just going to bring Carla up. Hi, Carla. Good morning. Can you see us all okay?
I'm still seeing the slide.
Any advice on that song? We're just checking this. Tech fixing. How's
No
your
worries.
exciting day at City Hall today? There we go.
No, exciting day working from home.
All right. Well, I think you should be able to see us now. It's all good?
Yeah, it's all great.
Awesome. Okay, perfect. So welcome. Carla Suarez is joining us from the City of Vancouver. Carla, I will turn it over to you to ask the first question to the students.
Great. Thank you so much. I just want to begin by expressing my gratitude to these brilliant students who have worked really hard on this initiative. And it wasn't a very straightforward question. And I really appreciated the opportunity to collaborate and learn from each other on this. Couple questions from me. I'm curious just where you're at right now with the models you're proposing, and do you see them being useful in other municipal public institutions beyond a municipality, like a school board or library or police institutions? Those are all other kind of municipal, local level kind of institutions.
Thank you so much, Carla, for that question. And also thank you for being here with us today. So each of the models, when we were looking at them, something that was important for us as an identifying factor is that all of them have to be transferable across city services. So even if, for instance, if we take the City of Vancouver into account, City of Vancouver provides services in housing, in transit, and community services. So it's like multiple different areas that the model would have to be tailored and customized to in order to capture costs in those areas. So all of the models are transferable across organizations and across sectors. And that is based on, we do have to say that that is based on what is cited about the models in academic or policy research. We didn't find explicit information about the models being implemented in different contexts where we could extract lessons from. But based on what is cited in the literature, all of the models can be transferable across different sectors. So for instance, the different institutions that you mentioned across, let's say a school governance board can pick it up to tally the cost for its own model, for its own institution. A police body can also pick it up to calculate the economic and social cost of racism to them. So they can be individualized and also customized to the context of whichever institution.
Great, thank you. Based on your jurisdictional scan, I'm curious about what are some of the kind of key lessons or insights that you've gained about anti-racism initiatives in public institutions? Like what stands out for you?
Okay. So with the jurisdictional scan, we started off by focusing on several high-income countries where we thought that their governance structure and their systems might be more aligned or attuned with Canada's. When we went out there, we actually only found implemented examples in Australia and the United States. In the UK, we did see that they advocate for such an approach, but they didn't actually do any calculation or any operationalizing on it. So when we look at Australia, this is the slide that we had on our jurisdictional scan as well. In terms of what Australia has done, they actually implemented the model that Mia introduced, the burden of disease model, where they calculated the DALYs and they converted the DALYs into monetary terms in order to get the cost. But for instance, if the City of Vancouver applied what Australia would do, it would only give them a cost in the public health context. The learnings for the city from this could be that, the city of, like Australia, for instance, partnered with several institutions in order to get the detailed race disaggregated health data. So, the learnings were that there's collaboration needed for any kind of costing analysis to take place for data. Another learning is that, which is something that formed our recommendations as well, that the city could potentially do a pilot in a smaller service area before rolling out the costing analysis across all services. So for instance, Australia started it out with just health instead of trying to hit all the different components of systemic racism. And similarly, for instance, in the US, they conducted a costing analysis as well, but they focused on economic indicators. So I think the key learnings from the jurisdictional scan in summary would be number one, that there are many different approaches to do this, but you have to really scope out what your focus area will be depending on what's important to you. Number two, that there are extensive partnerships needed across the service areas that you're focused on to get that race disaggregated data. And number three, preparing for the fact that it's going to be a really intensive task. Like it requires time, it requires resources, it requires partnerships. So it is something that is going to be costly on the budget as well. So I think those would be the three learnings for us from the.
Just want to quickly add something here. So when we look at the UK, we also found that UK, when even though it doesn't have a anti-racism like initiative, like national level, like quantifying initiatives, it did collect race-based and disaggregated data, and it now has like over 170 categories based on the race and also ethnic groups. So it also lays a foundation for their future anti-racism initiatives. And I think that's also a starting point for which Canada can learn and urge for data collection in the future.
I guess just building upon what my fellow mates just said, is the fact that a step has been taken further. The BC government has started conducting a BC demographic survey, which is collecting disaggregated race data. So it's one step ahead of, having the data to quantify this cost. So I feel that will be something which will be considered by the city of Vancouver as well, and should be considered. And that's one of our recommendations to the city as well. And that's what helped us go through this project when we were conducting the jurisdictional scan for the city.
Carla, I'm going to break in here. I'm hoping to get a question from Tara, and then I can go back to you if you have more questions.
Sounds great.
Okay, perfect. So I'm going to invite Tara Cookson, who was the faculty lead on this project, to ask a question.
Great. So my question for you is recognizing that all of the models did have strengths, but they also all had weaknesses. None of them scored perfectly in your criteria framework. Where would you recommend that the city of Vancouver start if they were going to test one out? Where do you think their time would be best spent?
I think you're using the podium microphone there. Yeah.
We'll just use this one. So the starting point for analysis is, this is kind of exactly why we recommended two models, where model one is a starting point. So model one would be the model that the city of Vancouver would start with for them to, because step one would be, how do you define systemic racism? And what are the different components that you have to take into account? So if you go back to the model, our vision was that they could leverage the cycle model to first define what systemic racism means to the city. The city already has its own definition of it, but how they want to customize that for the costing analysis, and then leveraging the model to identify the different areas that they would focus on. Like, okay, maybe for the costing analysis, we want to focus on housing because that's where our data is the strongest. Or maybe for the analysis, we want to focus on economic opportunity because there are more economic indicators available for them to do the costing analysis. So step one would be leveraging model one to define the process, to set your indicators, to set your goals and your objectives, and then the next step would be moving to model four, where they can then apply the model at the city service level to collect the data and compute the costs.
Great, great answer. Okay, so we do have time for a question from the audience, and then Carla, I'll give it back to you for the closing comments and any last questions you might want to ask. Okay, I know you can't see me. Sorry. For me, I have to walk across you for you to see me. So I'm trying to stay out of the frame here. Any questions from the audience? Yeah, up front here.
I'm Alessia. I'm a second-year MPPGA student. I just want to ask, what was the thing you learned that surprised you the most while doing this research?
I guess for me, it was the fact that there's also an economic cost associated with racism. That was totally new to me. I never thought that being of a particular race makes or breaks having access to a service. So that was a learning lesson for me. And now every day, maybe if I'm taking a bus or maybe accessing any service, I count that cost. So it's the economic cost of being or belonging to a particular race.
Any other reflections?
I think my key learning is that I did I had this assumption that Canada would have more data or more research on this case study because we always, highlight our diversity. But when we actually looked into this question, we found there was actually none existing models that we can directly use without digging deeper into it.
Elaine, you want to step up? Thank you.
I also had similar concerns about the lack of disaggregated data, or it's very protected and then it's really hard to access. And then governments also have trouble making it public as well. And what I really found is that policy can't address what it cannot measure. So I really think that disaggregated data is really key in this project.
Yeah. Nice. Okay, I know I said one question, but Ramana, the program director, has a question, and I am compelled to say, let's hear
I
it.
don't want to abuse my privilege, but I had a question for you to sort of to ponder about. So great presentation, all of you. So sort of look forward and imagine that you could do the study. What do you think the impact of that study will be on how the city of Vancouver is going to operate? And I'm going to give you a historical example to sort of think about. And the historical example was a few years ago, Amazon wanted to set up a second center, right? And they conducted a competition between different cities and towns, and all of them were invited to explain why they would be the best place. And Vancouver's selling point, which sort of got leaked out, was that its wages were lower than other places, right? And so if Amazon came in, they would make more money by setting up an office here rather than elsewhere, right? The point being that our current economic system thrives on this kind of difference, okay? If you have a population that can be exploited more easily, then that's a more attractive thing for those places. And people in power in those cities, in those jurisdictions, do like to play that up, right? So I'm just going to invite you to think about how this might play out if you were to come out with, and this is no aspersion on you, Carla, just to let you know, but this is how the history has been, so.
Yeah, and just for clarity, I was on city council when that proposal came forward. It was not a city of Vancouver effort. It was like a broad business community effort. But in any event, I will pass it over to you.
So with regards to the question, one of the assumptions that we were working with when we were developing the project, as I had mentioned, is that there are funding constraints for anti-racism initiatives. So when we were developing this project, our vision was that this project should be able to pinpoint towards new evidence that might lead towards more resources being allocated towards anti-racism initiatives. In terms of what you've mentioned for like market forces and how they play out, that goes a little bit beyond the scope of what we were aiming to do, because we were not so focused on, okay, if the findings do come out, then what are the ripple effects going to be? Our intent is more about how do we get the finding out there? So how do we get it out there that the city of Vancouver is losing this much money because of racism? And our focus was also on, okay, we want to pinpoint towards this new evidence so that there is new funding allocations towards this cause. Yeah.
Okay, that is great. Thank you, Ramana, for the question. Appreciated. Carla, we are just at time. Do you have any brief closing remarks for the students?
No, not particularly. I just want to thank them once again for all their work on this. Really appreciated the opportunity to work with you on this.
Awesome. Thank you.